I forgot before.
I'm really delighted to be here with you all. I see Peter, a super canvasser for my campaign, and Patricia as well. I'm just finishing up my very first day of committee hearings. I'm going to be serving on the Housing Committee, Higher Education, and the Environment Committee. We did pass a Medicare for All resolution at the town level. My husband and I canvassed for Husky for Immigrants this summer. I know that's part of the CT for all legislative agenda. And I'm just happy to be here with you all tonight. Thank you so much, Peter, for the invitation.
Of course, thank you for being here.
I'll call on Patricia.
Okay, so I am another person in Hamden and a friend of Lori's, because I know her, I know she's going to be great up there. They're just going to have to get out of her way. I'm more active, I have to admit, with the debt collective in both the student loan and the Medicare medical debt areas, subgroups, working groups, than I am probably with this group. But I try to be as active as I can in everything because I'm a Marxist and I want to make change as much as possible. So, you know, I guess that's enough of me. Oh, and my name is pronounced Venner Saavedra. Good luck.
I'm Sarah. I'm a student at Hopkins School in New Haven, which means that my marriage is just an Alaker and my congressperson is Rosa DeLauro. And I'm really I've been to a couple of these meetings, but a lot of the time when I have school in session, I have a sustainability board meeting that conflicts with them. But when I've been here, I've been really interested in pushing for in one, learning people's stories, and two, pushing for legislation that could further the care that people receive and the support that they get from government insurance.
Hi, everyone. I'm Paul. I'm new here. I'm a nurse. I work at Econ Health. I live in West Hartford. My reps are Kate Farrar and Derek Slapp is my senator. My network is mostly with nurses around the state, helping to organize nurses around certain pieces of legislation. One huge issue, even just the past couple of weeks, is emergency department overcrowding, and a big part of the solution to that is expanding access to primary care and preventative care. So I'm really interested to get involved and support expanding healthcare access in any way I can.
Mark, would you like to go?
Sure. Hi, my name is Mark Prue, and I'm the outlier here. I'm from Washington State, and I'm not quite sure how I got hooked into this group, but I'm interested in all things universal health care. It doesn't much matter, and I've been active for several years with our citizens group here, Whole Washington, and we just introduced a bill in the state Senate that would establish the Washington Health Trust. And we're not overly optimistic because it's being held hostage by a somewhat hostile senator. But nonetheless, we keep trying because we have no alternative. We are planning an initiative campaign for this year. So, and if we can't do it in the legislature, we'll try to do it via the initiative campaign. So I'm here simply to kind of observe and, hoover up any interesting ideas that I can glean from others' participation in the movement. I appreciate your time.
Thanks for coming. And in Connecticut, we don't have the ballot initiative option that I know Whole Washington has used in the past, which is, I don't know if it's a mixed blessing or a mixed, I don't know.
Well, it's a huge
problem.
lift. It's a huge lift because we need over 400,000 signatures. And I mean, that's an immense number when you don't have the budget to pay signature gatherers. And so we're, but again, the alternative is to get run over.
Thank you. David?
Sorry, I had to get unmuted. Name is David Englert. I live in West Hartford. I'm a retired molecular biologist, although I'm still somewhat engaged with molecular biology. In terms of politics, I've been mostly engaged with climate change. I think that's my main thing. I work with Third Act mostly. I've also worked with the CCAG and with Sierra Club. I really haven't done anything in the way of Medicare for All other than learn about it. And I've learned a lot about it over the last few months, attending meetings like this and reading. And I'm really, really filled with rage about how awful our system is. And I'd like to do something about it. It's just a matter of setting priorities.
Thank
So,
you.
but, I'm only one person.
And Phil?
Hi, I'm Phil Brewer. I'm a fairly recently retired emergency physician. Spent most of my career at Yale, and actually was one of the founding members of the emergency medicine faculty. Also a student of Quentin Young, who was the founder of Physicians for National Health Program. And so all of my life I've been in favor of a nonprofit, publicly funded healthcare system. And unfortunately, over the years, I've seen us gradually lose ground, and we're still losing ground. So my primary affiliation is with PNHP, Physicians for National Health Program, and when you look around, there's actually a number of groups that have the same thing in mind, and I believe in cross-fertilization, so to speak, and so I actively participate with this group as well as my other groups. My legislative goal for Lori is the problem is the fact that public employees in Connecticut, when they retire, they are forced to get their health benefits from managed care, from Medicare Advantage companies. And it's very clear that people who have more serious illness do not do well with Medicare Advantage. They do much better with standard Medicare. And so I would like to see the legislator take up a bill and hopefully pass it that would require that employees who retire and get their benefits through their work in retirement have the option of standard traditional Medicare. I think that would be a tremendous step forward in Medicare for All, because I think it would result in a lot of people choosing Medicare instead of Medicare Advantage, which is not an advantage. So I'm looking around for people to sponsor such a law, and that's my goal for this year. Of course, it'll take 4 or 5 years to get it done, but that's okay. Thank you.
Natalie wrote that she's at work, she can't talk, but works in the medical billing side of things, and shared that in the chat. Sees both large bills and denials. So we have a kind of a mix of people who are in the medical field, from different points of view. We had invited Representative Jillian Gilchrist also to come tonight. We figured that the committees you're on and the ones that she's on dovetail really nicely, but something came up at home and she couldn't make it. So I wonder if we could ask you if you could talk about what you see right now as the priorities you're seeing. I know all I hear in New London when people are talking about the session is what a mess it is to deal with Eversource. It's like that seems like it's taken up a lot of the news, at least in my corner. But are you hearing other things that are priorities of the legislators and of the governor's office?
Yeah, the governor gave his state of the state on Wednesday, focusing on making Connecticut affordable. He did talk about rising energy costs. He talked about education and housing, but I think the elephant in the room everywhere we go are the fiscal guardrails, the $1 billion that we've been putting away for the last 6 years, and then we're not funding important services like pensions or education, homeless services that have had the same stagnant budget for, I think, 3 decades is what I've been learning. So you've got about, I think there's 17 new freshmen in the House, 5 or 6 flip seats, and we just need to exert our will and try to get these guardrails adjusted so that services and just, that the state is affordable to people and that, it's great. It's always nice to have a rainy day fund, right? It shows fiscal responsibility. It's good to other people when they're deciding if they want to come and move to Connecticut. Hamden has a healthy rainy day fund that we've been working on over the last 3 years. But I think my struggle is when essential services aren't being funded and people are hurting and people can't afford to stay here. So we're trying to organize this freshman class with the Progressive Caucus and help from the Working Families Party, and CT for All just had a big press conference this morning, and see if we can't get those guardrails adjusted. I think they were put in place. We're not even sure they're legal. There was no public hearings on them when they came about. This is a little bit before my time, but I've been trying to read up about them as much as possible. But, and I think the governor always has the ability to veto, but I think, maybe our priorities aren't always going to be the same as his. Something that I've been working on, Peter's familiar with, is getting just cause passed so that people in our town are not just being evicted with no excuse or they're just being evicted, right? What we're trying to say is you need some sort of reason, because I get calls pretty regularly that people are being forced out of their apartments with no place to go, and there's no rationale for that. But I didn't hear him talk about that. So I think it's possible that the legislature's agenda is going to be a little bit different from the governor's agenda. And that's okay. We're separate bodies of government, but we want to make sure that the bills that we're producing don't get vetoed, right? Because I think somebody mentioned, these things can take 4 years. We're still working on a tax credit for children, and I think Kate Farrar has been working on that for years, and we're pitching it as like a freshman bill, but it's really not a freshman bill. We're signing on to it, but that work has been in the works for years. And I think, the best piece of advice I've gotten as a new legislator is there's really few new ideas in the building. It's really about trying to get things through, and a lot of the committees already have their ideas about what they want to do this session. And some of us new freshmen are just, trying to figure out where we fit in and what we can introduce. And if I was told if we introduce something and there's no sponsorship or we haven't talked to anybody, it's kind of dead in the water. So sorry, that's a little bit of a overview of where I personally, I've been in this seat since last Wednesday. But that's just sort of my perception of things.
Done. I guess my question for you, and I'll ask people to either raise their hand or put questions in the chat if they have others, is, you talked about, you're on the housing committee. There seems like there is an intersection between housing and healthcare.
Definitely.
That housing insecurity is contributing to healthcare lack of access or insecurity. And I wonder if there are any ideas about, I don't know, dealing with housing in such a way that might make it, I don't know, easier to that people would not lose access to all these other things they need in their lives.
Yeah, I think my answer about housing, actually, probably Peter could speak more about their Fair Rent Commission than I could, but it's having a place to go when you are living, especially in a rental that is not safe, and having a place to make a complaint, and having an out of court, holy body of citizens, landlords, tenants, just regular, everyday citizens, kind of making decisions and coordinating with our Department of Health or with our fire marshal, if what they're hearing about from tenants, what they're reporting. Sorry, my dogs just realized some of my family's coming home. They like to be part of the Zooms. Having a place where if there is a public health concern, there's a group that can coordinate those services. We're, in Hamden, our departments work very separately, and that's one of the beauties of a Fair Rent Commission, is that sort of thing can be coordinated. We're also trying to unroll a rental registry program, which again, maybe doesn't sound like it has anything to do with health, but we're going to require landlords to register, and we're going to hire housing inspectors, and those housing inspectors are going to decide if those are safe living conditions, and if they're not going to be able to rent. So I'm speaking a lot at the local level because I've been serving on the town council for the last 3 years. We're trying to figure out local protections, and then, you could do a statewide registry. That's going to take a while, and it's going to take a lot of political will, but I'm really proud of some of the stuff that we're seeing happen in Hamden, and the coordination of services that, 3 years ago, I didn't even know who to call. If someone, called me up and said, I've got bed bugs, I didn't know where to go or what to do. But I do think that these things are all related. I think housing is sort of the cornerstone for everything. The other thing that we're working on in Hamden is housing as a human right bill, so that we are not, if you do find yourself unhoused, and we expect to see more people unhoused over the course of this presidency, that we're not going to ticket you, that we're not going to criminalize you, because that makes things worse. So I'd love to see something like that at the state level. It's more of a human approach than we've seen, and we've seen other towns doing sweeps, busing people different places. And that's not really good. What I've also learned from talking to folks, we do have encampments on the Farmington Canal, is like, there's reasons why they maybe don't want to be in the shelter, and we need to respect that as well. So again, sorry, long answer about health, but I don't know, Peter, if you feel like, not to put you on the spot, but I know
No, not
that
at all.
you're doing a lot of that. Peter is on our Fair Rent Commission in Hamden, and I'm so grateful that we have a place for tenants to go with a variety of issues. Maybe your dishwasher's been broken for a year, but the health things are, really, some things are nuisance, but some things could even be a public health. Say you do have a bed bug infestation, then the whole building's, we need to act quickly on these things, or it does become a public health concern.
Yeah, I mean, yeah, for those not familiar, fair rent commissions are municipal bodies. So there's enabling legislation at the state level, and then each one is kind of like run at the municipal level. And in Hamden, well, the way they all work is, if you're a tenant, say your landlord wants to jack up your rent, 75% or something like that, which is, we've seen, you can file a complaint with the Fair Rent Commission. And then it's outside of a court, but there is kind of like a court-like proceeding, public hearing. And you make your case, your landlord shows up and makes their case. And then the commission comes to a decision and says either like, this rent increase is harsh and unconscionable is the term in the ordinance. And we can then either reject it completely or say, 75% isn't fair, but given X, Y, and Z, a 10% increase is fair. So we can do that. And what we can also do is we can say, we can put rent into escrow or things like that, depending on conditions in the unit. So someone might say, I don't mind paying more rent, but they haven't fixed this, or I have pests that they haven't adjusted, or there's mold and things like that. And so I think the way that the commissions were originally envisioned, I think back in the 1970s or so, the legislation was initially written. It was more for the former thing. I think it was kind of about like edge cases where rents were being really jacked up really, really high. But now what we're seeing more of is, in addition to that, people like saying, I don't have a problem with the rent, but these conditions I just can't live in these conditions and I have nowhere else to go. So we've had cases, a lot of mold cases, a lot of pest cases. I'm not going to speak to any of them specifically, but and a lot of people with chronic health conditions, a lot of elderly people on Medicaid with on oxygen tanks, where it's going to be hard for them to move. Or we've had people with mental health problems, dealing with noise and things like that. So legislation like a just cause, which would prevent, like a landlord would have to say like, okay, if you want to evict a tenant or not, I believe not renew a tenant's lease as well, you would have to say like, oh, they're not paying rent, or I want to move in myself or something like that. You couldn't just say, sorry, I'm not going to re-sign your lease, and then, add some new cabinets and then jack up the rent 75% in a few months.
I'm hearing from folks there's nowhere to move to. So we also, I mean, I think it's related to housing. It's more in the planning and development part of,
Yeah,
legislature, but where are they going to go?
it's a whole can of worms. Yeah, I mean, yeah, we just there's just not enough housing. Bottom line, there's not enough, and so that gives landlords enormous leverage to just, people got nowhere else to go, so they can raise rents as much as they want. They can let their properties degrade to a point where they wouldn't be able to if there was a healthier housing market, because people would just move out. But people feel kind of backed into a corner because housing stock is so limited and prices are so high. And that, that's one stress affects people's health. But, we've heard cases where people are having asthma flare-ups, or asthma, people who never had asthma before in their life suddenly are dealing with it because of water intrusion and mold and things like that. Pests are obviously unsanitary. If you are dealing with housing insecurity, if you've got to find somewhere new to go and you're on a fixed income, you might not be able to make the doctor's appointments. You might have to start rationing medication, things like that. So there's definitely a huge, so many different issues are interconnected at so many different levels. But I think housing and healthcare and health more generally are really like, there's a huge amount of overlap between those two. So that Lori being able to push for that kind of legislation is I think going to be huge for the health of particularly vulnerable people in Connecticut.
Yeah, we have just cause. I believe it's 62 and over and disabled, that protection exists. So the case I'm trying to make to my colleagues that we already have this, we're trying to expand it, and we really want to protect more people. I'm concerned. I'm hearing rumors about carve-outs for 5 or more units, but in Hamden in particular, we have some of the mega landlords. They'll have separate LLCs. They'll own one unit and then have a different LLC for another unit. And my job is, when I'm working on something, is to be protective of as many people as possible. So I'm not really in favor of any carve-outs. I'll do my best. I'm not going to vote no if that's what ends up happening. But we really, it's our job to be as protective as many people as we can possibly get. And you're right, Patricia. And sorry if I'm talking very much in detail about Hamden. Hamden is what I know, but we do have another issue in our part of town, which are, and I think this, I want to say Rep. Foster had this issue, but on the scale of like thousands. We have a couple hundred homes in the south part of town that were built on part of a landfill, and the foundations are crumbling. And it's a very complicated issue, but it's expensive, and it needs to be fixed. And it's also there, as you note in the comments, there's a health intersection there as well. I mean, if you've had a dry home and all of a sudden you have water coming in, now you have mold, then you don't have generational wealth to hand off to your children or grandchildren. So it's very, very intersectional. There's a nearby property. I was just at a little gathering to celebrate our progress to try and get Six Lakes turned into a state park. Again, a brownfield in the south part of town. Environmental justice area, very close to where these homes are. And the Olin Corporation has owned the property for decades and is letting it languish. And we don't know what some of the health concerns are there. We've been gently pressuring them to do testing, but we want to make sure it's remediated, and we want to allow people to be able to sort of passively go on the property, because I think this is the same district with the crumbling homes. I think everybody needs access to green open spaces, especially like you're saying, Peter, if they're dealing with asthma in their apartments or in their homes. It's so vitally important that we preserve and make really safe those green spaces in town.
Even though you're talking about Hamden, it resonates a lot with what I'm seeing in New London. We have green spaces that are in, poorer census tract areas of town that are being neglected, being used as kind of lay down areas by the city, where they're just dumping stuff, broken concrete to be ground down later for reuse. And it really is a huge issue that, and in New London, it's the north part of town that has the problem, but also a capped landfill, and and what housing there is. We don't exactly have a shortage, but we have a shortage that is affordable.
Yes, we're very familiar with that in Hamden.
Does anyone else have local issues where there could be state legislation to support things that need to be done in your towns? Okay, I have one more question here. About 4 or 5 years ago, what you mentioned that the resolution that Hamden passed probably about 4 years ago. New London passed a resolution actually the month before COVID happened. I think we were the first in the state. And one of the reasons it passed unanimously was that we did the math and how much of our city budget went towards providing health insurance for city employees and retirees. And it was the largest line item after wages. So even the more conservative penny pinching counselors saw the numbers and thought, wow, we could save this much money if there was like a statewide system. As a new legislator, do you feel as though it would be useful to restart a resolution campaign to get towns to take a stand in favor of more access to public health insurance?
I think so. I think you know, I'm in this unique position where I'm finishing out my term on the council and starting this state rep position, but I kind of love it because I can see what I can do at the state level, but I also approach all this work as an organizer. So from the organizer mindset, I think the more municipalities that can pass it and then send it on to their state rep or send it on to their senator, it helps us up in Hartford say, this is something that my residents really want. My local board of alders or council or whatever it's called in your, you know, municipality really want this. And it makes it makes some of our jobs easier. I think some people are in more purple districts, some people have flipped seats, some people are nervous and want to be safe. But you know, I'd love to see the housing as a human rights resolution. I'd love to see that pop up. I kind of want to target some of the places that are doing sweeps to kind of put pressure on the mayor to stop doing that. I think there's benefit to it if you have the capacity, because I know it takes a lot to organize. You know, you can start by finding, you know, friendly council people in different districts and get their ear. And it's pretty simple. I think y'all do a beautiful job organizing and sending us like sample legislation. I think we just passed what was sent to us. I think it went through our majority leader, Ted Stevens. And, you know, it gets local community to come out and give public comment. They can come in person. They can come, they can send stuff online, as Patricia's often online, which it's so helpful. It really is. It's really helpful for us to hear what you want us to be doing. And you can always email as well. So to be able to hear that that's a priority of your community, it makes our jobs easier up in Hartford.
Can you speak a little bit to the timeline? Like if we want legislators to work on something, I'm guessing it's even late now, you know, 2 days into the session to start anything new, but are there some periods of time that there's still a way to have some influence this year?
I think a lot of the committees have their priorities, but I think since everything is always so cumulative and everything takes so much time, it can't hurt to, I don't know, would it go through the insurance committee and maybe that's Cabrera? Like I never think it's a bad idea to start something because it takes time. So, and maybe Representative Gilchrist would have some better ideas since she's been legislating a little bit longer than I have. Yeah, I think, you know, have a press conference, come up to Hartford, organize some people, and meet with your reps, email your reps, and make sure that people know that this is important and things gain momentum. We all spend a lot of time talking with each other in the hallways. So I'm trying to rally freshmen to get on the Just Cause bill just to show the Committee of Housing that the freshmen are behind this. I mean, a lot of stuff happens in conversations, and you know, I think it may be too late to get a hearing for this session. Possibly. Again, that might be a question for someone more experienced than me, but I never think it's a bad idea to kind of start.
Patricia, you have your hand up.
So do petitions actually work, sending petitions up to Hartford?
Yeah,
Or
it's,
is it
I
better to
think,
be local?
yeah, I think they're tough. I mean, we did do for Six Lakes, we did submit recently to Senator Looney 2,100 signatures. I mean, it makes for a good photo op. It's a lot of work. I think former 5th District Councilperson Justin Farmer went to a lot of public events and concerts and farmers markets, and it's also an educational piece, right? So you have that conversation with someone, or you send it out on a listserv, or you put it on Facebook and people are like, what is this? So it's impactful, I think. I mean, I think everything is helpful.
Yeah, I know when we had the campaign behind the Medicare for All resolution here in Hampton, we had a petition that, I think we got a couple hundred signatures at least. And Dominique Baez, who was the president of the town council at the time, mentioned that when they passed it, they said, we've never gotten more letters and emails about anything than this. And I don't see how we could not pass it at this point. So I imagine the impact of petitions, things like that, probably are greater at the lower level of government. Probably make more of a difference in a town council than at the governor's office. But I've seen how they can make a difference. And more than anything, I think they're a way to make your case to a lot of ordinary people and try to like change hearts and minds really at a grassroots level. I know with Medicare for All, I think, one of the big things about the resolutions campaigns and petitions behind the resolutions is like, it gives you an excuse to knock on people's doors and say like, hey, do you know about Medicare for All? Do you support it? If not, here's why you should. And that's, there's not a lot of other ways you can like harass people like that. But if you have a clipboard, then suddenly they're willing to talk to you.
And I think, Peter, you or someone else grabbed me at, was it like a concert or Earth Day, or there was some event, and that's what, it got it on my radar. And then when
I think it was Pride Day, or so. I think it was like Hamden Pride Day at the park.
And I was like, no, that sounds good. I mean, those conversations are helpful. If my legislation isn't being led by my constituency, I'm doing something wrong, right? So that, like, I have everything that I'm going to be putting in, our personal bills are due on Friday. Everything that I'm going to be putting in has been groups meeting with me, sending letters, emailing, calling, meeting me at the Capitol. That's where those are coming from.
Sarah, you had a question or comment?
Yeah. Well, thanks so much for being here, first of all. And then my question is, I know you mentioned that you were on the environmental committee, and I was wondering if there's any sort of how you envision the issues that you have talked about or are going to talk about on that committee sort of intersecting with public health, because I know that there's a lot of overlap there.
Yeah, there's a lot of overlap. That committee at this time, I have like the least amount of information about. We are meeting on Friday, and I haven't had a chance to meet with the chair yet to figure out what his priorities are going to be. There's a rumor that there's going to be a leadership bill that's around climate action. Yeah, I mean, I would just speak locally to my community about that intersection of that property that's been not taken care of for years. And it's 102 acres. I was just at the little, celebratory gathering, and there are 2 residents of the Whitney Center who are in their 90s, and they just want to see, they overlook the property. There's like a bog and swans and all these, bird watchers and all kinds of cool stuff. And they're like, we just want to see this done, in our lifetime, because they can look at it, but they can't go there and walk around. And then the same for the rest of the southern part of town. Anybody, once we open it up, I think as a state park, anybody can access it, but it's going to have the largest impact on this part of town, which has been redlined, which is dealing with crumbling homes, which has been neglected. So I, work closely in town with the Hamden Alliance for Trees. They've been trying to put in more trees in the south part of town because there was a period where they just cut them all down. And Peter can attest, door knocking in the southern part of the 5th district, there's no tree canopy, which means there's no extra, oxygen and coverage. And there's just so many like health benefits to us.
It's hot.
Planting trees. It's really hot. I mean, just like the pavement, you can feel it kind of burning your flesh as you're walking around. And it makes it, as a canvasser, a candidate, not that pleasant. But imagine this is where you live and it's hot all the time. And we have a food desert here. There's no grocery stores in this part of town either. So yeah, I'll have to get back to you on exactly what the environmental committee is up to. The thing that I'm going to be pushing for is a middle ground remediation status Right now, we remediate to industrial. So like you've got a building there and you're there in and out 9 to 5, but you're not sleeping there, or residential. And what we'd like to see for Six Lakes is passive recreation. So somewhere in the middle where people can come in and walk the paths and then take their trash out. People do not want road bikes. We probably won't have swimming or fishing there because there's been chemicals that have been dumped there. Batteries have been dumped there. And I think there were some firing ranges, so there's bullets and things like that in the ground. And, I think this part of town has been neglected. And I think if it were a more wealthy part of town, this wouldn't be allowed to happen. So it really is social justice and environmental justice issue. And it's hard to keep focus on it, but I've been working with this coalition for the last 3 years, and we just keep adding membership. We've got the Hampden Chamber of Commerce, the mayor's office is on board with us now. It's all organizing, right? And keeping pressure on the $8 billion a year corporation that owns the property to clean it up and really do the right thing and return it back to the residents of Hampden so that they have like a really nice park that they can just enjoy at their leisure. You got it.
Yeah. It's crazy how much like sort of environmental effects like that. And like you'd think that like a few degrees wouldn't matter that much, but it's crazy the effects it can have on like health conditions and especially if you have like asthma or other pre-existing conditions.
Yeah. Oh, that's a good article. Oh yeah, we've got a lot of heat islands in this area.
In those neighborhoods where there isn't much open space or tree canopy, have you seen in the schools poor fitness levels? I know about 10 or 15 years ago, I looked at that in New London, and one of the elementary schools in the most northern part of town where most of the public housing was, there was very little parkland. The kids' fitness, everyone was screaming about how the kids' reading levels were behind, but actually their fitness levels were much worse than their reading levels because they couldn't get out.
That makes sense to me. I haven't seen any data on that. The other thing is we bus kids from this part of town up to Spring Glen Elementary School. So they spend a lot of time on the bus and they're not walking to their neighborhood schools, which, isn't that like the American dream to be able to walk your kiddos over to school? It makes sense. I haven't seen the data, but that seems right.
There's about 10 minutes left, and I wonder if we don't have any more questions right now, if I know Phil is here from PNHP, others might be in other groups to give very brief updates of what groups that are working for similar things are up to and what the priorities are, so we can be mutually supportive.
Well, I'll be glad to pitch in for what PNHP is up to. Two things. The main thing is we are on a fairly long-term concentrated campaign against Medicare Advantage. And just little exchange I've had tonight with Patricia in the chat. What people don't understand about Medicare Advantage is it's probably fine as long as you're pretty healthy. If you're not pretty healthy, if you get sick, that's when you find out how awful Medicare Advantage is. You find out about pre-authorization denials. United Healthcare denies a third of all of the pre-authorization requests that they get. They're the worst. And it's probably It may be for that their CEO was chosen as the target for assassination. It's because they are the worst, but they have computers using AI guided algorithms that that take these requests for CAT scans, for medications, for surgery, etc. And they deny 1 out of 3 of them. And a human being has never actually seen the request. Only a computer has. And they count on people not challenging the denials, or maybe challenging them once, but not a second time. And so when you're really sick and you're trying to get the care that you need and it's being denied, then you kind of wish that you had traditional Medicare, because there's virtually, it's not that there's no pre-authorization in Medicare, it's very limited, and an actual physician, an actual medical professional looks at the request and makes a decision based on the clinical evidence and not on whether they have some quota so that their CEO can buy their 3rd ski chalet and their 2nd yacht. That's the problem with Medicare Advantage. Medicare pays out 98 cents for every dollar it collects for health care. 98 cents for every dollar. Medicare Advantage pays out about 83 cents for every dollar they collect. So that other 17 cents goes for profit and overhead and stock buybacks and so forth. And so we are on a concerted campaign to stop the gradual rise in the percentage of the market that's going to Medicare Advantage. And some of the things that are happening that are good signs and bad signs, they're signs of how bad things are. There are a lot of healthcare organizations now that are cutting ties with Medicare Advantage. There are 4 or 5 that are not accepting any Medicare Advantage. There are certain companies that are losing their contracts, and so that's our main priority for the coming time. And of course, we're all concerned about the new administration and all the cuts that are going to happen. The Medicare, the Medicaid, the extended Medicaid or expanded Medicaid program is coming to an end in most states because the federal funds are coming to an end, and most states have not voted to come up with their own funds to replace the federal funds. So, for instance, in the state of Illinois, this month, 800,000 people are going to lose their Medicaid. Yeah. And Illinois is Illinois is it's a blue state. It's even worse in the red states. So there's a lot of work to be done. We're concentrating on one thing, and that's Medicare Advantage, because we think that's the best place to establish that a publicly financed nonprofit system is what works the best for everybody. Now I'll step down off my soapbox.
Does anyone else want to report on, what's happening where they are?
I can report a little bit on the debt collective, because we have a medical debt section. It's not specifically, we do all support expanded Medicare for all, or some kind of universal. We aren't universal health care, but our main focus is, of course, people who already have medical debt, and how we can fight against that, kind of in similar ways to the student debt, which we have been very effective with. In fact, my own student debt was released because of a lot of the work that we did. But the medical group works slightly differently, and I'm just getting used to it because I only recently got involved with them. But I know that we're thinking about some kind of action in DC, and we're considering if we want to make it just DC or if we want a nationwide, where if you can't get to DC, you can get to your capital, or you can get to your town hall and that kind of thing. So we're kind of thinking about that and what we want to actually ask for in these things. And, asking for Medicare for expanded Medicare for all is probably one of the things that will come up and that will be on the list.
Anyone else want to report?
I just have a request for Phil. Phil, you mentioned a piece of legislation that you're looking for sponsors for. You want to talk about this. I'm going to be engaging with legislators around climate change stuff. So I could work on that with you. I could, work on my representatives or other representatives in the state to look for sponsorships and try to educate people about the bill. So if you could just sort of link us up to your efforts, that would be great.
I'll put my email in the chat, so anybody who wants to contact me.
Mark, any last words on what's happening on the other side of the country?
Well, like I said, we have the bill presently in the Senate. What we're trying to do is get one of our House members to introduce a piece of companion legislation. So, for example, we've been, getting the word out to everybody to, pepper their legislators with requests for that. So I just got done doing that today. It becomes what we've been doing for the last several months is going all over the state, conducting a series of town halls to refine our proposal and kind of just hear mostly we wanted to hear from people as opposed to us telling them stuff. And it's and that's been beneficial in terms of refining the legislation that we now have, and that's been very good. I just I hope we get better at hammering nails, because we've hit our thumb a lot, it's such a heavy lift, and this should be like the biggest no-brainer on earth. And it's difficult to be, to remain upbeat, but you, on the other hand, have no real choice but to keep putting one foot in front of the other.
Thank you. As we plan monthly meetings, next month, the second Tuesday is February 11th. These are the issues that have come up that we will be trying to address. The MCO, the potential for MCOs in part of Medicaid, I think is still outstanding. We're not really sure if the legislature will have a lot of power over Governor Lamont's proposal to examine the potential for cost savings by putting private gatekeepers into our Medicaid program. There is the Health Policy Project has a lot of info in that, and if you want, I will try to find their email address, their website. I think the study was completed, and it showed that our system is pretty good without the MCOs for most groups of people. The other issues. I think Husky for Immigrants is going to be meeting later this week and figuring out what their legislative agenda is. The choice for retirees to be able to choose traditional Medicare, which is near and dear to me because I'm one of those forced into Advantage plans people. And if there's any support for, retiring or dealing with people's medical debt, prevention and dealing with, and the potential for also on town levels getting resolutions passed to just build that constituency of not just individuals who want public, not-for-profit healthcare, but also municipalities that are really suffering under the current system. So hopefully we'll deal with those in future meetings, but thank you all for coming. And I will try, I have our own email address here. And I think, I don't think I can find the MCO address quick enough. I'll see if I can really quickly.
I have a question. Just what is an MCO? I'm sorry.
A managed care organization.
Thank you.
So one thing that is really great in Connecticut is that it is one of the very few states in the country that about 10 years ago kicked out the for-profit gatekeepers in Medicaid. And I think we're one of maybe 3 states in the country that have a purely not-for-profit public Medicaid program. And just last spring, our governor, who I think Phil noted is married to a potential investor in the medical industry, wanted to explore whether things could be better if we introduced managed care because most states do it that way. Fortunately, the group that studied it said that in most cases, our results are great and got better over the 10 years that we made it a public program. There are a couple of groups, maybe elderly, that there are some issues that, in my opinion, putting in a managed care would not help those particular issues, but there is the potential for it being expanded into some pieces of Medicaid. So yeah, so that's a Connecticut issue. And as of last time I heard, I was not sure whether it was going to come through the legislature or whether the governor was going to channel the process some other way. And I did promise that email address, and I'll put it in the chat, and then I think it'll be time to kind of end for the night. This is the MCOs. It's on the Connecticut Health Policy Project's website. They're keeping people abreast of this particular threat to something that isn't really broken. So thank you, everyone. And we do put all of these recordings online if people want to look anything up. So thanks a lot, and have a good night.
Thanks, everybody. Thanks for having me.
Thank you for coming, Lori.
Good to see
Bye.
everybody,
you.
especially Lori.